after this. So what is the pathological reflex if this is grade 3? Which grade 3 is pathological? Because all grade 3 are not pathological. If somebody is having anxiety, anxious, right? Nervous, so you will see their reflexes are exaggerated. But which one is pathological?
Both sides.
Asymmetry on one side. Right? Asymmetry. One is exaggerated and the other is not exaggerated. This one. Spread of the reflex, right? If you do the reflex here and it spread to the shoulder or to the other side, this is spread of the reflex. Right?
Yes.
Okay, then
Going to the other one.
Babinski sign, right? Plantar upgoing with the
Yes.
reflex. This is pathological.
On the upper limb.
Upper limbs is not only alone, right?
Ah.
When the upper limb is there, the lower is also there. Alright, go ahead. The big equivalent of the Babinski in the upper limb is Hoffman sign, right? This these fingers will flex reflexively if you do this, like this. Okay.
Normally flexing or
No, normally nothing. No response, right?
positive response?
Flex. Okay, go ahead. Now the other reflex. After this.
Directly, tapping directly on the same position, right?
Okay. Tapping on the tendon, just and the
You can put your finger or you can lay it directly. Alright, so compare to the other side.
okay.
Brachioradialis, right?
Triceps.
We do biceps, triceps, and then
Yes.
brachioradialis, right? So after biceps, make a habit of triceps. Palpate the tendon and then hit it.
No
Right?
feel. That's one.
This also, this looks a bit awkward. Huh? If you put it like this, the patient will be more comfortable. Right? That is also okay, but that is awkward. So palpate the tendon and direction here, extension here. Right?
Yes.
Okay, you can do this then. Hold it like this. You are left-hander?
No, right hand.
So hold the hammer in right hand and then you palpate the tendon. Oh, raise it, right? Raise it up and leave it as a free fall. Up. Okay. What is a free fall? Hold it like this. Palpate the tendon and raise it like this. You see? Like this. Right? Now you will the reflex. Leave it here like this. Alright. Be careful when you are palpating, doing other things, do not hold the hammer because you might hurt the patient. Right? When you are hitting them, take the hammer. Yes. So this is C. Value.
Which one?
Biceps.
C5, C6.
Basically C5. Only C5, C6. This one.
C5, C5, C6. C5.
Dominantly
C6.
C6. C6, right? This is more C5, C6, but dominantly C5.
Okay.
C5, C6, but dominantly C6. This is
C7.
C6, C7, but dominantly C7, right?
C7.
This one, finger reflex, you will put your finger on the finger and hit it, you will see a flexion here, right? So this is
C8.
C8T1 but dominantly C8. Okay. Clear? This you have to practice yourself, right? In the coming days, you need to practice the reflexes. On each other, first try on normal people, right? Go to any patient, check the reflexes. You will find many cooperative patients for normal reflexes. Do the normal reflexes on them first, and then you go to the patients. Stroke patients, whatever they are on the floor, exaggerated or depressed reflexes, you will see. As many reflexes you will do, you will get more comfortable in your exam. Alright, after this, I prefer, before doing the reflexes, I prefer personally to check coordination. Because once you go to the tools, you might forget. Usually people forget checking the coordination. So first finish the examination with your hands and then you go for the tools, right? Once you started tools, you should have the sensory after this, keep your tools like this, right? The examiner will also provide you the tools in the exam, but if you have your own tools, take your own bag and put these in sequence for yourself. Before starting examining the patient, put them in the sequence, right? After this, you put the pinprick, right? Or whatever you are comfortable with that, you put them in your order. Then what you are going to do, then you will not forget in the exam. In the heat of exam, because you are in hurry, right? And you want to do quickly. Because you have a limited time, so no need to think one by one. It's because if you put them in the sequence, it's guiding you by itself that what you are going to do next, right? Because I have seen people forgetting the plantar response, right? Because they are in hurry and they have not practiced before so much. This should be on your spinal level. What I will do next. So before going to the reflexes, I prefer to do coordination, right? Right, so it is a screening test. It tells you that his cerebellum is okay. The central of the cerebellum, peripheral of the cerebellum is okay. This is screening, right? Then you can, the center of the cerebellum problem patient cannot sit, right, without support. He will fall to one side, central cerebellum problem. The peripheral cerebellum, we check these tests, finger nose test, pass pointing. So first instruct the patient, show to him that he will touch your finger and his nose like this. Right? So it should be full extension, right? Do not do it here because mild problem will be masked. You have to extend fully and power should be 4 or 5, then you should check. Less than that you should not check. And move the target, right? So now you check for me. You are the examiner. Okay. Instruct me. You should do like this, I will do like this.
You should touch my finger and then touch your nose.
Okay.
No, extend your hand.
So this is depending on your target.
Okay.
You see, doing yourself is very important, right? Okay.
It's
Okay, so what's happening?
Pass pointing, dysmetry.
Pass pointing, right? This cannot touch, it goes to, right? This is not, he cannot touch the point. So this is dysmetria. What else?
Intention tremor.
This is intention, tremor, targeting. While attempting to touch something, are doing a task, the patient develop a tremor, right? This is called intention tremor because I am intending something. After intending something, there is a tremor. This is intention tremor. Cerebellar tremor will be pill rolling, right? Sabbah. But when you ask the patient, this is resting tremor, right? During rest. But if you ask him to do some task, then he's okay. But while he's resting, you distract him, right? Tell him Arfa yadik, then he will have more this one. Or recite Al-Fatiha, then he will develop more tremor, right? Distracting him, resting tremor. Frequency is high, low frequency compared to the resting tremor, compared to the essential tremor. The third type of tremor, which is essential, posture tremor. You ask the patient to do, this is not coming in rest, but when they do something, then the tremor comes. Like they are taking water or cup of tea or putting tea in something, right? And making a posture, then they get tremors. High frequency, right? 10 to 12 or more than 12 amplitude. Fast tremors. These are called postural tremors. These are essential tremors. This one is pill rolling, resting tremor. Improves with task. Cerebellar is only while attempting touching something. And essential tremor in posture. When you ask them to outstretch the hands, they will have tremor. Essential tremor. We will discuss this. You will have a lecture on movement disorders. We will discuss that. Okay. So you have to check the coordination. Then another test for coordination. Yes, rapid alternative movement. You should be extending very good. So the speed. Rapid. Yes. Okay, this also you can do on this side. Like this or like this. Okay. So you compare the sound and the speed on both sides. Okay. So then comes
Sensory.
sensory. This. Okay. Sensory. Huh? Try something.
Temperature.
You know, always volunteer. Remember, this is not your exam. This is the place to learn. This is the place to do mistakes. One can never learn without doing mistakes. If you volunteer yourself and do your mistakes here, you will have less mistakes in exams, or maybe no mistakes in exams. Okay, please go ahead.
Okay. To explain first. Okay, we have multiple tasks in the sensation. First, we have the light touch, and we have for the pain sensation, and we have for the proprioception, and for the, all of it while he closes his eyes, and also for give him an object to try to ask him to identify it.
Particle sensation, right? So it means we have how many modalities of sensation?
Pain temperature. Pain temperature here. Light touch.
Our aim is to know that there is a nerve problem, or problem in the spinal cord tracts, or problem in the cortex. Because this is the axis, sensory neuroaxis, from the peripheral nerve to the spinal cord, then going to the thalamus, right? Internal capsule, going to the cortex, posterior limb of the capsule, and going to the cortex. So we should check. You have limited time, right?
Yeah.
In exam. So if you have a scenario that the patient is having, I told you, examine the upper limb and do the relevant, then you should quickly screen. So screening, we have in the spinal cord and the nerves, they are taking which modalities of sensation?
Posterior.
We divide them into yes.
Cerebellum.
Okay. Posterior column, anterolateral system, right? Or spinal element. This is the same thing. ALS, anterolateral system, or spinal element. These are the same. And we have dorsal column or posterior. These are the same. Right? So you are quickly screening. So you select one from each. This light touch is shared by both. Posterior column and anterolateral system both are taking light touch. So aside. No need to check this, right? But this is an exam if the patient is pricked by so many people. It's difficult for the patient, right? Then we take this alternative for that. At least it can tell you that there is impairment of sensation or not, which column is affected, then we can judge that by other tests, right? Right? So for that purpose we can use this, but to know that this is dorsal column or anterolateral system, this is not giving us more information. Right? Cortical sensation, you give some, you should have two objects, right? One for one hand and another for another hand. That the patient can know these things are not, right? Alright. Okay. غمض عينك وعلمني ايش هذا بيدك. شوف هذا غمض ايدك باليد. Check by your hand, what is this? Can you tell me?
Okay.
Very good. Okay.
غمض.
غمض عيونك وعلمنا ايش هذا.
Cover with pen.
Very good. Cap up with pen. Right, so you have checked. What is this? Stereognosis, right? If this is lost, astereognosis, right? He cannot recognize the object. Then you can check, which Ahmad is very fond of. Okay. Ask him to close eyes and draw any figure, like a circle or number, right?
Okay.
Make some ترسم على يده.
بكتب رقم وقل لي وش الرقم ها بالعربي ها. كم.
Okay, now the other side. Now draw some circle.
الحين برسم رسم وقل لي وشو.
Square.
صح. رسم ثاني.
Okay. So this is quickly you have screened cortical functions, right? And sensory and attention, how you will check? Sensory and attention. Cortical function also.
Sensory inhibition.
Extension. This is called extension. Easily you can check by visual thread also. Tale hai na? You will see is not blinking, right? It's violet, right? You will give quickly a visual threat. That if he has extension, he will not blink, right? Alright. Or you touch him on one side. طيب غمض عيونك علمني وين اللمس يمين ولا يسار. الآن كلاهما. Okay. So
2 points.
if he has sensory and attention on one side, he will tell you only the other side when you touch him. Alright.
2 point discrimination.
2-point discrimination, you should have 2 points together. There is a geometrical instrument which is you can apply, make it 5 millimeter or 2 millimeters, right? If you do it on the hands, they are more sensitive, right? They can discriminate up to 2 millimeters even on the fingers
1 millimeter.
and on the face
The
also,
back
right?
5 centimeter.
Alright, so it depends on the area where you are checking. That one you do not waste time. If they ask you to do cortical sensations, they ask you to do the sensory system or check the sensory system, then you do all the sensations. If they do not ask you
Upper limb or
do the sensory system or check the cortical sensation, you do not waste time on this, right? Just give him some object and ask him what is this, this is enough, or draw something on his palm and screening quickly. I ask him if you want to check the dominant one, when abhamak yamin. He does not have finger agnosia. This is also an important test, right? Okay. So, what other sensation?
For the screening or the thumb?
Right, the screening in the upper limb examination, these are not needed, right? What you need is a quick assessment, a quick screening. So what you will do?
Pain, you can read temperature.
If you want to give him pinprick, or you can, now it's a cold weather, so this we can check, by this we can check the temperature also. Gamma the unit, barid, wala har.
Again?
okay.
Yeah, let's go.
Barid, right? Gamma the unit, is,
Yes.
كيف؟
Go.
زي فوق؟
No, it's focus. No.
Focus now.
Yes,
Same, gamma the unit.
yes.
Same, right? This should be the next question. So you can check this cold and warm by touching with the steel or with the rubber. Rubber is not cold like the other objects, right? You can.
So,
Very folk.
yes.
Adi.
Yes,
Not warm but adi. Yeah? Right. So
Soft sound.
this you have, and if you want to check pinprick, so you should.
Doctor, why do you have the tongue depressor?
This is also for
Yeah.
pinprick, right?
Gag reflex.
Gag reflex also. You can use these or you can use the.
Break it and
You should break it and make it sharp. So you will touch the sharp end and the blunt end and ask the patient, right? So first you should have a reference, right?
Yeah.
In sensory system there must be a reference, like the forehead. Open your eyes because this is pain. Pain is felt the same by closed or open eyes. Eyes sharp,
Yes.
zay hard, zay shoka,
Yes.
right? Zay folk. Right? So first question is you feel it, he tells you yes. The other is Zayfor, like above. This is comparison with the reference. If he tells you yes I feel but not like my forehead or the chest, then you should go up and tell him when lima tahassil Zayfor al-limni. So he will tell you. If it is here, then it is a glove pattern. If it is if rarely in some cases you might have the involvement of dermatomes, right? Like in cervical cord lesion, cervical myelopathies, you will have in some, or you have a brachial plexus injury, then you will have a loss in dermatomal pattern, right? So I did dermatomes with you before, if you remember.
Yes.
What is this one? We start with this one, right?
3, 4.
No, 3.
C5?
C4, right?
C4.
I told you this is a beige dermatome, like the police and army people, they put their stars and crowns here, right? Beige dermatome, C4. Then this is
C5.
5, 6, 6 more.
C7.
7,
6, 7, 7 also. 8.
8,
T2.
T1,
T1, T2.
T2. This is T3. The
T4.
nipples,
T4.
T5, and then the
Black.
anterior costal
T6.
margin is T6 and the lateral one
T10.
T8. umbilicus is T10, hypogastrum is T12, right? And when you put your hands in your pocket and touch your thighs, this area is L1. Inside of the thighs is L2. Outside the knee is L3. This side of the shin is L4. This one is L5 and goes like this, right? And comes like this S1. One walks on S1. Khatawat ala ramal. Shifter. The lateral side we are touching, right? This is S1. And then from here up is S2. And one sits on S3. You are sitting on it, you are S3. And then in between is S4.
S5.
Okay. That's fine.
S4 and S5.
Side, no?
Yeah, right?
How about the back? Extend to the back.
Yeah, the same.
Thoracic.
The same. Right? Clear or not clear?
Clear.
No limb is clear.
You do like this, right? 4, C4, C5,
C7,
C7, similarly here also. This is T1, T1, T2, T3, T4. And this T6, this is T8, this is T10, and this T12. This is L1, L2, L3, S4, L5, one walks on S1, here is S2, and one sits on S3. And in between is S4 and S1. Clear?
Clear.
Alright. So, in the lower limbs, as I told you, alright. So, one thing is left in the upper limb, sorry.
Vibration.
Posterior column. So, which one you want to check?
Vibration proprioception.
The easiest one is joint position, right? No need for the tools. So, joint position, can you check please?
What?
Joint position test.
Proprioception.
Proprioception, joint position in the upper limbs.
Come with the light.
خليه one by one.
Okay.
لا ما في غمة دي من أول. First show to him, right? Explain to him with open eyes that what you are going to check. Then show to him. Right?
Yeah.
No, on his finger. On his,
Should I do it from every joint?
So ideally, we check the index finger, right? At one joint, we should stabilize the other joints, leave one joint and show to the patient. هذا تحت وهذا فوق. طيب أنا يبغى أن تعلمني اتجاه الحركة. غمض عيونك. طيب الحين علمني اتجاه الحركة. لا اتجاه الحركات. You told him flexion and extension. He's following you, maybe he's your friend. Right. How much I should move? 15 degrees to 20 degrees, not more than that, right? Otherwise you will miss the subtle abnormality. And I should hold from the sides, not like this, because you have pressure receptors. Then they will transfer, right? Yes. So you should hold from the side and move. If you cannot get it on this joint, you move one joint up. If you cannot get it on that, you move one joint up.
Similar to sensory.
Yes, one joint up. Right? One joint up. Like this. Alright. And compare on the other side. So you do on the other side.
So doctor, for the sensation and the pain and everything, you start distally. Whenever you find it, you stop.
If it is intact distally, then it is intact proximally. No need for the other finger, right? One finger, follow one finger. Usually we take index in this and big toe in the lower limb, right?
Big thumb on big thumb.
Yes, big toe and index finger. Shahada. Right? Alas?
That's it.
Alright. Thank you.
Thanks,
So now No, intijal. Don't ask him Talbala 4. Guess. He will tell you 4. Maybe guess. And it will be, you will do this and ask Talbala 4. He will tell you 4. But he cannot recognize. So you ask him the direction of movement. Al-Limni, intijal. Don't give him Talbala 4. Yes.
What do you think?
All right, now please the next. The relevant, right? Suppose you found that he has weakness in the right upper limb, right? Okay, thank you very much. Your job is done. Lower limb now we want. You want lower limb? You should be lying down here. Okay, thank you very much. I will do this. So, in relevant, you found that his right upper limb is weak, right?